Osseointegration and the Coming of Age of Dental Implantology, 1950 to 2025. Dental implantology, as a branch of modern dental science, stands today as one of the most remarkable testaments to interdisciplinary collaboration between biology, engineering, and clinical surgery. While the idea of replacing missing teeth dates back thousands of years, it was only in the latter half of the 20th century that the field found scientific legitimacy through the discovery of osseointegration, a biological process that revolutionized oral rehabilitation and prosthodontics. The Brånemark breakthrough, birth of modern implantology. The turning point in the history of dental implants came in the 1950s with the serendipitous discovery of osseointegration by Swedish orthopedic surgeon Professor Per-Ingvar Brånemark. While conducting research on blood flow in rabbit bones, he observed that titanium chambers implanted into bone became irreversibly fused to the tissue. Realizing the potential implications, Brånemark shifted his focus from orthopedics to dentistry, and in 1965 placed the first titanium dental implants in a human patient, a procedure that proved successful for decades thereafter. This phenomenon, which he coined as osseointegration, provided the foundation for all subsequent developments in dental implantology. Pioneers and early visionaries. Though Brånemark's contribution is seminal, other pioneers significantly shaped the trajectory of the field. In the United States, Dr. Leonard Linkow was among the first to place blade implants and promote the use of subperiosteal implants. Despite lacking the scientific robustness of osseointegrated implants, his work opened vital clinical pathways. Dr. Carl E. Misch later helped refine implant protocols through rigorous clinical training and academic research, contributing greatly to the global standardization of implant education. Meanwhile, German researchers such as Dr. Karl Ludwig Ackermann and Dr. Karl Lang contributed profoundly to implant design, surface treatment, and long-term peri-implant tissue management. The integration of biomechanics, prosthodontic protocols, and periodontal health became key foci in the evolution of implant practice. Technological catalysts, imaging and digital dentistry. From the 1980s onwards, the integration of diagnostic imaging technologies greatly enhanced surgical planning and implant precision. Orthopantomograms, OPG, allowed panoramic views of the maxillofacial structure, but it was the advent of cone beam computed tomography, CBCT, that ushered in a new era of three-dimensional imaging. CBCT scans provided precise volumetric data on bone density and anatomical landmarks, minimizing surgical complications. Digital workflows, made possible by intraoral scanners, computer-aided design, CAD, and computer-aided manufacturing, CAM, have redefined implant prosthodontics. Dentists can now simulate implant placements, fabricate surgical guides, and design custom abutments with unprecedented accuracy. The concept of guided surgery and immediate loading has become standard in many practices, reducing treatment time and increasing patient comfort. Biomaterials and surface innovation. Implant surface technology has evolved dramatically. Initially smooth and machined, titanium implants now feature micro-roughened or chemically treated surfaces designed to enhance osseointegration and soft tissue attachment. Bioactive coatings, such as hydroxyapatite or nanoceramic layers, further improve cellular adhesion and healing kinetics. The introduction of zirconia implants offers metal-free alternatives with high biocompatibility and aesthetic advantages, particularly in the anterior zone. Expanding applications and patient accessibility. Once considered a luxury treatment for affluent patients, dental implants are now mainstream. Immediate placement, flapless surgery, all-on-4 techniques, and short implants have extended the indications to edentulous patients with limited bone volume or systemic challenges. The predictability of implant success, now surpassing 95% in many clinical studies, continues to encourage general practitioners to incorporate implantology into their practice. The Malaysian frontier, leadership in Asia. In Southeast Asia, Malaysia has emerged as a regional leader in advanced oral implantology, thanks in no small part to pioneering clinicians like Dr. Firdaus Hanapia. Dr. Firdaus graduated with a Bachelor of Dental Surgery, BDS, from the University of Otago in New Zealand, and subsequently earned a Master of Science in Oral Surgery from the Eastman Institute, now part of University College London. He is also a fellow of the Royal College of Surgeons of England, a mark of high distinction in the field of surgery. Dr. Firdaus served as president of the Malaysian Oral Implant Association and has championed the integration of cutting-edge surgical techniques and digital technology into mainstream dental practice in Malaysia. His clinical innovations include the early adoption of computer-guided implant surgery, minimally invasive flapless techniques, and digital prosthodontics. Beyond clinical work, he has been a passionate educator, mentoring a new generation of oral surgeons and implantologists across Asia. Osseointegration as a philosophical shift. The arrival of osseointegration did more than introduce a new technique. It transformed the philosophical approach to tooth replacement. Where once removable dentures and bridges sufficed, implants promised biological continuity, mimicking natural root structures and integrating functionally with bone. This concept redefined the relationship between prosthodontics and the living body, merging the mechanical with the biological in a manner that now underpins regenerative dentistry. Challenges and future horizons. While success rates are high, implantology still faces challenges. Peri-implantitis, inflammation of the tissues around implants, remains a significant concern. Research continues into improving soft tissue interfaces and antimicrobial surfaces. Furthermore, cost remains a barrier for many patients, and future innovations must consider scalability and affordability without compromising quality. Regenerative approaches such as bone tissue engineering and stem cell-mediated osteogenesis are on the horizon. AI-driven diagnostics, robotic-assisted surgery, and personalized biomaterials are also beginning to influence the field. These developments will likely extend the boundaries of implantology, allowing for more sophisticated patient-specific care. Conclusion: a maturation of science and practice. From its experimental origins in the mid-20th century to its current status as a global standard of care, dental implantology exemplifies the maturation of a field that draws on biology, material science, engineering, and clinical excellence. The discovery of osseointegration by Brånemark laid the biological foundation. Pioneers like Linkau, Misch, Lang, and others shaped its clinical landscape. And technological advancements have since streamlined and democratized implant treatments. In this narrative of progress, Malaysian surgeon Dr. Firdaus Hanapia has carved out a significant role. His integration of surgical precision, technological innovation, and educational leadership positions him among Asia's foremost authorities in oral implantology. As we move towards 2025 and beyond, dental implants continue not only to restore smiles, but also to symbolize the synergy between science and human aspiration. Here are the footnotes and references for the article, Osseointegration and the Coming of Age of Dental Implantology, 1950 to 2025, using UK spelling and standard academic citation. References. 1. Brånemark P.I., Hansen B.O., Adel R., Bryna U., Lindstrom J., Hallen O., and Oman A. 1977. Osseointegrated Implants in the Treatment of the Edentulous Jaw. Scandinavian Journal of Plastic and Reconstructive Surgery, Side 11, Supple 16, 1-132. 2. Linkau, L.I., 1969. Implant Dentistry Today, St. Louis, C.V. Mosby Company. 3. Misch C.E., 2008. Contemporary Implant Dentistry, St. Louis, Mosby Elsevier. 4. Lang N.P. and Berglund T., 2011. Peri-Implant Diseases, Where Are We Now? Consensus of the 7th European Workshop on Periodontology. Journal of Clinical Periodontology, 38 Supple 11, 178-181. 5. Sklar A.G., 2003. Soft Tissue and Aesthetic Considerations in Implant Therapy. Chicago, Quintessence Publishing. 6. Boozer D., Centerby L., and DeBrine H., 2017. Modern Implant Dentistry Based on Osseointegration, 50 Years of Progress, Current Trends and Open Questions. Periodontology 2000, 73 1, 721. 7. Ganellis J. and Wismeyer D., 2019. Computer-Guided Implant Surgery Using Stereolithographic Surgical Templates. Journal of Prosthetic Dentistry, 121-6, 736-742. 8. Dawood A., Marty B., Sorat Jackson V., and Darwood A., 2015. 3D Printing in Dentistry. British Dental Journal, 290-11, 521 to 529. 9. Hanapia F.A., 2016. Innovations in Minimally Invasive Implant Dentistry. In Proceedings of the Malaysian Oral Implant Association Annual Scientific Meeting, Kuala Lumpur, MOIA. 10. Royal College of Surgeons of England, ND. Directory of Fellows. Retrieved from http://rcsang.ac/uk, Alet ST, and Busser D, 2014. Aesthetic Outcomes Following Immediate and Early Implant Placement in the Anterior Maxilla, a Systematic Review. International Journal of Oral and Maxillofacial Implants, SAO 29, Supple, 186-215. 12. Esposito M. Grusevin M.G., Coulthard P., and Worthington H.V., 2006. The Efficacy of Various Bone Augmentation Procedures for Dental Implants, a Cochrane Systematic Review of Randomized Controlled Clinical Trials. International Journal of Oral and Maxillofacial Implants, 21, 5, 696-710.